Hello, our truth warriors. It's time to pick up those bottles of shit your caring doctor gave you and see exactly what harm it is causing you. I'm here today with the incredibly honest Dr. Jim Meehan to discuss the top 10 most prescribed drugs and give you an understanding of just how many millions of people from all around the world are unknowingly destroying their health under the guise of staying well. If you want the best advice on how to really take care of yourself, then this man here with me today will help you with the best advice and products available. But this has to start with you taking responsibility for your health and getting out of the rut you are in. Share this podcast with others who you know are also trapped in what we call Farmageddon. Hello, Jim. How are you today?
I'm so good, Chris. What a great intro. You nailed it. Farmageddon. I love it. That is well, and I hate it. But it is unfortunately the place that we live in because of, the way I used to say the way our broken healthcare system works, but what I recognize now, it's not broken. It's working exactly the way it's designed to work. It's pushing pills, pill for every ill kind of business model. And my profession is not waking up to the fact that they're being lied to, misled, gaslit, that we're allowing pharma to do all their clinical trials and then push these weak evidentiary behind closed door studies out onto the public and through the FDA, which they now fully own and captured, to probably, cause more harm than good in many situations. Many on this list are exactly the most commonly prescribed drugs on the list that you shared with me. And that's a good list. That's what I would have come up with too.
Excellent.
They're causing more harm than good.
And that's it. And I think people don't realize that majority of these prescribed drugs, they're not there to heal you or go to the root of the problem. They are just there to mask the symptoms and allow you to live life with the illness still continuing within the body.
Right.
Yeah.
That's exactly right.
So let's jump straight in. We're going to go from 10 to 1. We're going to kind of lump a couple in so people don't get to hear the same thing over and over again. But we're going to start off with number 10, which is hydrocodone, or as I try to pronounce it, acetaminophen, which is used to treat moderate to severe pain. Can you tell us the side effects and the problems of using this particular medication?
Well, and the main problem here is the opioid. So this is an opioid combined with acetaminophen. Acetaminophen can decrease glutathione production in your liver. It's fairly toxic to the liver, but the real problem here is the opioid. And this goes back. I could spend the rest of our time together talking about the problems with opioids, but I'll identify a really big one that is poorly understood. That the big one is that opioids, although they mask the effects of pain in the central nervous by blocking some of the pain centers in the central nervous system in your brain, they are simultaneously causing what's called opioid-induced gliopathy. Big fancy word, combination of words, but what it is those opioids are actually binding to opioid receptors. Opioid receptors are naturally bound to by the endorphins of your body, your natural pain, natural morphine type derivative that your body produces naturally. That's what naturally stimulates your opioid receptors. But the pharmaceutical industry created derivatives of those endorphins that are substantially more powerful. Hydrocodone is several times more powerful than morphine. Which is many times more powerful than your natural endorphins. But when things like hydrocodone and even more powerful derivatives, opioid derivatives like oxycodone, and probably chief among them almost fentanyl, which is flooding the southern border of the United States right now from China, and snuffing the lives of many of our young people. But when these powerful opioids bind to the opioid receptor throughout the body, they are also binding to the opioid receptors on these support cells in your brain. About 70% of your brain tissue is created by glial cells. These glial cells, when opioids bind to them, they cause those glial cells to release inflammatory molecules. So when you start that prescription of opioids, it starts to stimulate the release of inflammatory molecules in the central nervous system. Your brain starts smoldering. Yeah. The smoldering inflammation, given time, chronicity of treatment, the more powerful drugs that you use, the more that inflammation builds, and it eventually creates an enhancement of your pain. I have had patients that you could take a feather and stroke the inside of their arm. That would be a pleasant sensation to most people. But when you've been on chronic opioids, things that wouldn't have hurt will begin to hurt. Minor pains become major pains, and even pleasurable sensations become like a burning sensation when you stroke the inside of that arm. And what that drives is more and more higher blood levels of the opioid medication to try to suppress that central nervous system perception of inflammation. I tell many patients, it's like you're holding, hundreds of volts of energy coursing through your body, and the only thing that can bring you relief is to, be put to sleep or have the parts of the brain that can perceive anything of that nature put to sleep. That's what opioids do, and they drive, so they enhance your pain over time, and not only that, but they erode so many other systems of the body. I was really actually surprised that the opioid medications were not higher on the list. Yeah. I got really involved in that area many years ago as I saw the increasing amount of deaths from overdose. There were physicians in many parts of the country that were using, opioids as I call it chemical dependency as a business model. Once you get somebody addicted to a class of medications like an opioid or a benzodiazepine, they're lifelong customers. They come back every month. They get their refill, because if they don't, they start withdrawing, and it's just a painful thing to foist upon any patient. I help a lot of patients overcome their dependency, their physical dependency, meaning a physical dependency is like when you have developed kind of a tolerance, when your body has begun pushing against that overstimulation by an opioid or a benzo or an antidepressant class medication. Many things do this. They start down-regulating the receptors that thing binds to. And when your blood levels of that thing, that drug, that hyperstimulates that neurotransmitter system declines, you suddenly plummet in that neurotransmitter or that function. So with opioids, when you suddenly plummet, all of those systems just start screaming at you. Your bowels become hyperactive. You'll have diarrhea, horrible, painful, even convulsions, seizures. All of that pain comes roaring back. So that's opioid-induced gliopathy is something every doctor should understand. Not enough understand it. If we told every patient before they got that prescription that, look, here's the potential problems, that you could experience: an enhancement of your pain, constipation, disruption of your hormonal systems, et cetera. They would always say, let's try something else. And the other thing I would add to it is the largest studies of the management of pain, one of them is called the Oxford Pain Study, has shown that the best pain relievers, the top 10, none of them are opioids. They're all non-steroidal anti-inflammatory type drugs that have not a safe profile, but a much safer profile than opioids.
Yeah. So it's kind of like a heroin addict. Most heroin addicts, it's not the high that keeps them addicted. It's the fact that as the drugs wear off, they feel so bad that the only way they can feel better again and not as sick as they are is to continue taking that product. And it sounds very similar to the addictive nature of these painkillers.
That's exactly it. I mean, you nailed it, Chris. They're not staying on the medication because it's, making them better. They're staying on it because they feel so much worse when their blood levels wane and the dependency and the withdrawal manifests. And that's true of opioids, benzos. I mean, it's true of proton pump inhibitors for gastroesophageal reflux disease, heartburn. It's many drugs, antidepressants, many drugs cause that same kind of dependency and withdrawal that captures and binds and patients to that drug for long-term use.
Yeah, it's terrible. And I know other side effects of that product is liver damage, increased sweating, shallow breathing, irregular heartbeat, fainting and loss of consciousness, having no blood pressure, which sounds completely safe, severe sleepiness. So there's many additional side effects with this.
Oh, yeah.
When people say side effects, that effectively it is the effects. It's not side effects. This is what comes for many people with taking this product, and the pharmaceutical industry seems to think that this is an acceptable norm, and it just can't be.
Yeah.
So let's go to number 9, and we're going to group number 9 in with a couple of other products that are in the top 10. This product is called losartan, which is an ARB, and I'll ask you what an ARB is, which is used to treat high blood pressure, very similar to amlodipine, which is number 5 in the list, which is a calcium channel blocker for high blood pressure, and also lisinopril, I hope I'm saying these right, which is also an ACE inhibitor. What's an ACE inhibitor and an ARB, and how are all these 3 products connected?
All right. So all of these blood pressure medications are trying to alter blood pressure by working on a very complex hormonal cascade called the renin-angiotensin aldosterone system. And, not that you have to know all of those things, but they're all working kind of on the same system at different points on that system. And with the idea of changing the way that system is going to regulate your vasoconstriction, vasodilation, fluid retention in the kidneys. They're working on various organ systems all at the same time by how they're altering the expression of those and the action of those various hormonal cascades. So at the end of the day, a lot of the side effects are very similar. And the adverse effects are very similar. There'll be things like ACE inhibitors. They have one of the most common ones I see a lot is this dry, irritating, persistent cough in some people. It's thought to be due to a release of a chemical that dilates blood vessels in the lungs. Because again, the receptors that a lot of these are working upon are broadly manifest and expressed throughout the body. So you're trying to change you're trying to enhance vasodilation of the blood vessels, which is one of the key mechanisms for treating blood pressure. Is you want to take those stiff, constricted blood vessels and allow them to vasodilate better. But you're also affecting blood vessels in the lungs, and so you're altering some of that normal activity. They get all of the blood pressure medicines. One of the first things you got to be careful of is hypotension or low blood pressure.
Yeah.
So you can drop your blood pressure too low so as to create, loss of consciousness, passing out, getting dizzy when you stand up. They can cause, leaking of your blood vessels and causing edema in your tissues. They can impair normal kidney function and actually induce kidney damage. So that's true of all the medicines that we just described. I think for sake of simplicity, whether it's an angiotensin receptor blocker, whether it's a angiotensin converting enzyme inhibitor, an ACE inhibitor, or a calcium channel blocker, they're all just working on different receptor systems that influences how your body, how your blood vessels are relaxing, how the kidney is passing fluid or filtering fluid or retaining fluid in your body. And here's the bottom line that I just try to teach all patients. We don't understand enough about the immense complexity of the human body, and especially something like that hormonal cascade of the renin-angiotensin, that RAAS system. That system is so complex. We don't understand enough about it, but we're intervening with powerful drugs that change aspects of that system and create untoward side effects.
Yeah.
The most blood pressure can be treated. First things that we should be doing to treat blood pressure should be, number one, make sure that you have magnesium going into your body. Magnesium is essential for the relaxation of the smooth muscles. Smooth muscles surround our blood vessels. If you have insufficient levels of magnesium in your body, then those smooth muscles can't release from their constricted state. And magnesium deficiency is absolutely very, very common. In fact, I would say over the course of 20 years, I have probably found 2 patients and 30,000 that had optimal levels of magnesium when we did intracellular testing, use a special laboratory that looks at T-cell levels and intracellular magnesium. The reason for that, Chris, is because we live in a sugar-rich environment, a carbohydrate-rich environment, and every molecule of carbohydrate that our body must metabolize will deplete your body of about 54 molecules of magnesium. So most people are walking around with a big magnesium deficiency, and simply starting to restore that. I try to take about 400 milligrams of magnesium, and a certain kind. Magnesium glycinate or bisglycinate is one of the most bioavailable forms. I try to take that twice a day. If you have the kind of blood pressure problems that cause a headache, you want to also use magnesium threonate.
Yeah,
for that. And then the next step that I usually do 1 and 2 at the same time is I want to increase nitric oxide production in the blood vessels. So you can do that with red beet based products. I think we've talked a little bit about that in previous episodes, but red beet is kind of a natural vegetable that has a optimal content for increasing the amount of nitric oxide that's released in our blood vessels. And nitric oxide allows your blood vessels to simply relax, vasodilate, and improve blood flow. And then, this might be a little controversial in some cases, but the evidence is absolutely solid. I also use I use a class of medications that are like Cialis. Tadalafil is a generic for Cialis. Low dose and more, advanced cases. Before I ever go to a blood pressure medicine in one of these classes, I'll often use low dose daily tadalafil because it very nicely, reliably increases the release of nitric oxide in your blood vessels. So not only is it useful for improving blood flow to the genitals, which is where it originally came from, was its use as a vasodilator and improving blood flow for erectile function purposes, but it improves blood flow throughout the body in a low dose, 5 I personally take 5 milligrams of tadalafil daily for its cardiovascular protective benefits. Yeah. So there's lots of things that you can do before you ever have to go to these medications. Now, here's another problem that I think is really relevant, especially in this day and age. It's that many of the generic drugs that we're getting from China, being manufactured in China, in factories that we can't visit and regulate, are being found to be contaminated with carcinogenic substances and contaminants that are dangerous to the user. And every one of these class of drugs has faced recall from an FDA that has limited agents, limited ability to see the problems and detect the problems, but they're very commonly being found to be contaminated with these agents. And I think it's either just a representation of the poor manufacturing processes that they have there, or maybe it's just intentional in the 100-year plan to destroy America. That's me. So I tell my patients, if you're on any of these medications, number one, let's get you off of them. let's do diet and lifestyle and exercise-based things, get your magnesium up, etc. But let's get you off these medications, because like this conversation with opioids, there's some, when you powerfully stimulate any system in the body, you create some dependency, you create some receptor down regulation, and you can kind of lock yourself into a state in which you need the medication, after you've used it for months ongoing for months, you start to have to take the medication, because when you try to stop, your blood pressure goes through the roof for a while.
Yeah. And I know the losartan, again, it's meant to heal you of these things, but it can actually damage the blood vessels in the brain, the heart, and the kidneys, which results in strokes, heart or kidney failure. So it's not good stuff. And the amlodipine, which is that calcium channel blocker. What concerned me with that is this is free at a lot of pharmacies. I mean, it seems strange that a drug company would push something in pharmacies and allow it to be free. But it's, again, the problems that you discussed there, where it can cause strokes and it can cause that fluid leak into surrounding tissues, as well as many other problems. This has actually been banned in the Netherlands and several other countries because of the issues it causes. So it's crazy that these things are still allowed on the market, even though the manufacturers and the experts looking into them are still very well aware of the problems that these are causing. So let's jump to number 8, which is metformin, glucophage, which is used to control the blood sugar levels in type 2 diabetes, which is a massive thing. A lot of people around the world with diabetes. Yeah. Let's talk about this and the problems that comes with actually taking this to control the blood sugar levels.
Yeah. So metformin is a class of medications that increases insulin sensitivity. It's commonly used in type 2 diabetes, where the constant elevation of insulin that's resulted from a constant exposure of your body to too much sugar and carbohydrates is starting to create some insensitivity at the insulin receptor. And so that's its main, its primary mechanism of action is improves the sensitivity of those insulin receptors. It also has some beneficial effects. This would be one that I use metformin periodically for reasons other than those two I just described, but those are useful. But one of the other things it does is it blocks some of the sugar absorption in the small intestines. Now, the biggest problem that most people have with metformin is the gastrointestinal discomfort, gas, bloating, diarrhea that will sometimes sometimes occur when you initiate therapy, and it's thought to be mainly associated with gut dysbiosis. If you have a imbalance in good and bad bacteria in your gut, metformin is kind of like a superfood for the good bacteria. 5 or 6 of the key species of bacteria that is associated with a good gut microbiome really proliferate with the use of metformin. And so they get they get the army of good guys pushing against kind of the more pathogenic, the Clostridium difficile that are trying to maintain their position in the ecosystem. And it creates World War III. And so that causes some side effects. There is some question about its toxicity to the mitochondria of our body. So the mitochondria are those little energy plants inside our cells. Some cells have as many as 2,000 mitochondria that are going to receive oxygen, turning it into energy. And metformin can impact negatively that chain of events that creates ATP. Yeah. There's a couple of studies that have looked at this, and I've looked at the studies, and it doesn't appear to be, the studies were mainly on brittle diabetics and aged men. Doesn't appear to have that much of a negative effect unless you're a high level endurance athlete, which I do have a number of endurance athletes that do, 100-mile marathons. And I tell them, if you're on metformin, you probably want to stop it before your event.
Yeah.
I mean, metformin is one I could probably, I can see kind of both sides of the issue, but metformin, has some other benefits. There's, in Dr. Jeffrey Dash's new book, Cracking Cancer Toolkit, there's a lot of studies that he found on the use of metformin and some of its anti-cancer properties that have been found. It's has an anti-inflammatory effect. You can find the good and bad. What were the worst things that you found on metformin? What was your take on metformin, Chris?
Well, I'm seeing that it's giving abdominal or stomach discomfort.
Mm-hmm.
Again, it can cause those coughs or hoarseness in the throat, muscle pain, cramping, painful urination, anxiety, sweats, coma. They list comas as a possibility, but it can also cause confusion in people as well. So it obviously has something that can affect the mind.
Yeah, well, it can, for one thing, it can lower your blood sugar. If you're a relatively healthy person with good blood sugar control, metformin can actually create a low blood sugar problem. At the very least, would make you kind of hangry. You're hypoglycemic, you're hungry, irritable, you're in that hangry zone. So, and then coma, potentially because of its blood sugar lowering possibilities. I mean, like most drugs, all of these things can have different levels of toxicity in individual patients. You have to really consider their kidney function, their liver function. A big thing, Chris, and here's a big take-home point. Everybody should do their own drug interaction analysis. You can go online to like drugs.com and they have a free drug interaction checker. You can put in all of the drugs that you're being prescribed and look for those drug interactions. You will often find, I have every new patient in my clinic, I teach them how to do it right at the beginning. And I have them put in all their medicines and they're always amazed. It's like, how did my doctors and my pharmacists not catch that? And I asked the same question. I'm just like, how do you not do this for your patients? It used to be considered a standard of care. If the doctor didn't catch it, certainly the pharmacy would, but they're not. And I see multiple major drug interactions occurring in a lot of patients. And often their problem is that drug interaction. They're on multiple serotonin affecting drugs. They're on drugs that are, inhibiting an enzyme that breaks down that drug, and one drug's inhibiting it, making the other more powerful. You see that a lot with opioids and benzodiazepines, for example. It's one of the side effects of opioids is it will cause respiratory depression and coma and death. And especially if you mix it with certain medications or even certain foods that will prevent the enzyme that breaks that opioid or that benzo down, that enzyme system, if it becomes inhibited by something like grapefruit juice is a very common one. It will basically double or triple the effect of that drug, in a matter of hours. That might push you to a point in which respiratory depression and coma results.
Yeah. So, I mean, the cocktails of the combinations of drugs that are being prescribed are not only the problem for a lot of people, but can the actual side effects from one drug then become something that somebody would go the doctors with that side effect, and rather than consider that side effect is what they're on, they just prescribe another drug to try and tackle that side effect?
I see it all the time. So you're taking something like an ADD medicine. So somebody's on a amphetamine based, Ritalin, Vyvanse, one of the neurostimulatory amphetamine based medications, and now you're anxious. Okay. So what do? They give you an anxiety medication. Okay. And then, you can't sleep well because why? Because you're on a long acting amphetamine. Yeah. So now you're on a sleeping medication. And by the way, most of the sleeping medications they don't promote sleep. They might cause sedation. They might put a part of your brain, your human brain to sleep, but they leave the brainstem awake, like Ambien and Lunesta. They put the human brain away to sleep. They inhibit it. They sedate it, not sleep it. Sleep is a complex time of electrical activity. So when you're using something that just simply sedates, you're heading in the direction of Michael Jackson, by the way, that by the end of his treatment, he was doing IV anesthesia drugs to be sedated into a state that is nothing like what sleep is supposed to be, Chris.
Yeah.
And then, you're sleeping shallow. You're not sleeping deeply, and deep stage 3 and 4 sleep is where we release growth hormone, one of the most important hormone systems in the body. So now you're aging prematurely. You're not healing rapidly. Your immune system is being suppressed because of, how these things start to stack up and inhibit normal function in the body. And I'll say it again. I've said it before. I'll say it again. What I always say is when scientists and doctors try to assume the role of God, they do the devil's work. We're trying to shortcut some of these systems that we don't even begin to understand the complexity in. And we're not creating sleep. We're not suppressing pain. We're just fidgeting around with a system that we don't understand, and we're creating a cascade of negative effects that you will pay for in more way than one. You'll certainly pay for it, and you'll see your bank account go down, and the pharmaceutical companies get richer, but your health is being eroded by it progressively. I see it all the time.
Yeah, because that's it. I mean, the natural release of that melatonin when you go to sleep puts you into a deep sleep cycle. And that deep sleep cycle is the body's natural time when it repairs the body. When you get that rest, it's able to work on the injured parts, the sick parts of the body. And if people aren't getting that, then it's just exacerbating the problems that they've got, that they're never getting into that natural healing cycle of the body. And again, I imagine at that point that the symptoms and the problems that causes, off they go back to the doctor again. And what does he do? As a
another
look,
pill.
we'll give you another pill. And that's the sad thing. So number 7, we covered, that was the omeprazole, which was for the blood pressure. But let's talk. Number 6 is gabapentin. And this is a medication used to treat seizures like epilepsy. I know that you can actually overdose on this. It's quite a dangerous thing in the wrong hands or using the wrong dose. And many deaths are known from that. But let's talk about some of the problems and things that this causes in its quest to stop the seizures.
Yeah, so gabapentin, brand name Neurontin, and there's others like Lyrica. They're cousins to benzodiazepines. They work on the same GABA system, neurotransmitter system. So GABA is the major neuroinhibitory neurotransmitter in the human body. GABA is really, really important. The problem with gabapentin and drugs like it and the benzodiazepine class is they powerfully alter and stimulate these receptor systems in ways that alter normal physiologic activity in the thermostatic range or homeostatic range that neurotransmitter should be in. And as a result, they can, just like benzodiazepines, they have a significant addiction potential. Now, the industry tried to tell us that, gabapentin works differently, works, on a different calcium receptor system in this GABA neurotransmitter system, so they won't have the same addiction potential. Well, yeah, it's a huge addiction potential. Lots of people have deeply altered that neurotransmitter balance to the point that they're downregulating their receptors. They're dependent on the drug to just not feel anxious, in a fear state. Basically, they're in a fear state chronically.
Yeah.
And they become dependent on taking more and more of the drug. I mean, this is one I really hate. It's a very common physical dependency and addiction potential medication that's being used because of it has a less of a stigma. It's the DEA classifies these various drugs in different levels in what's called the DEA schedule of medications, and I think it's a Schedule 4, so kind of the least dangerous schedule on that, but it's still dangerous.
Oh yeah.
And it's particularly dangerous when it's combined with other medications that work on that neurotransmitter, that GABA system. Opioids interact with it very poorly. It deepens the addiction and dependency that's created with opioids, and they're commonly prescribed together.
Yeah.
But drowsiness, sleepiness, inattention, destroyed memory, no libido, no energy, no drive to get up and get off the couch, increases sugar consumption. It really, what originally it was a psychotropic medication, a psychiatric medication used to treat seizures, anxiety disorders, bipolar disorder, and now it's just being used for everything, every trash can diagnosis that they can come up with there. And even doctors are prescribing that as a sleep medication. It's interesting how many drugs are prescribed off-label. When one of their negative side effects is something like sedation, drowsiness, that some doctors will start prescribing that drug as a sleep medication, using its adverse effect as a therapeutic effect. It's just nonsense, Chris, and it's dangerous. And we can't control those systems the way we pretend to.
Yeah, I looked into it. There was also talking about uncontrolled back and forth rocking, where people are sitting there, they can't stop the rocking, abnormal eye movements and balance problems, difficulty speaking. It can cause reoccurring infections, the memory loss, tremors, peripheral edema, and much more. Like you said, it's
well. If you listen to that list, and thank you for providing all of those, I probably should try to list every one, but if you listen to that list that you just described, they're all a manifestation of what happens when you take the major, GABA is the major neuroinhibitory neurotransmitter. When you start disrupting its levels, you will find you'll be in that as your blood levels wax and wane, when they hit those trough levels, and your body is kind of taking away some of the receptors it used to have for your natural GABA. Yeah. What happens is you rock, you have abnormal movements, you have jerky movements, you're anxious all the time. It's like the normal balance, the normal inhibition mechanisms have been taken away from you. You've been robbed of them. And now everything's like hyperactive, jerky movements, loss of fine motor control. The list goes on. So you go from a sedated zombie to, a hyperactive, looks like you're on meth. You vacillate between these two extremes because some doctor, kept you on a medication for far longer than, some medications might be beneficial for a few days, maybe but the rule for me is you start getting beyond 6 to 9 weeks with almost any medication that works on a neurotransmitter basis or a hormonal basis, your body will start working against that and creating a counterbalancing mechanism that will lock you into the use of the medicine, or you face, painful withdrawal symptoms. Chris, one thing I would say is that number 7 was omeprazole. That's Prilosec. That's actually a proton pump inhibitor class of medications. And I want to say something about that because a lot of people are on these proton pump inhibitors.
Yes.
So proton pump inhibitors are a medication that's prescribed to people that are having gastroesophageal reflux disease. They're having heartburn. And what it's doing is altering and decreasing the stomach acidity, the output of some of your cells in your stomach that are creating the gastric acid. Now, why is that a big deal? Well, because stomach acidity is a part of how we digest and break down food. It's also how we kill some of the bad stuff that comes in our mouth through our food, bacteria, fungi, viruses, parasites. So when you start altering your stomach acidity, you're opening yourself up to dysbiosis, to parasites instead of being killed, passing, getting into the intestines. When you start decreasing your ability to break down the foods that you eat, you're going to become nutrient deprived. You're not going to have you won't get the amino acids that your body needs. So you're starting to rob yourself of many of the building blocks for the tissues and the functions of your body. And the result of that in the long term looks to be a number of cancers. Kidney cancer is associated with the use of proton pump inhibitors chronically. Dementias, a lot of Alzheimer-like organic dementias are occurring in people on chronic proton pump inhibitors. When the problem is often not a stomach acidity problem, it's often food intolerances, other things that are causing loss of the sphincter action between the stomach and the esophagus, and there are better treatments for that. Often we need to be careful about the foods that we're eating, which ones cause us problems. But the point, without getting into the details and spending too much time, there are alternative treatments, and there's another side of this argument that says the risk to benefit analysis for chronic use of proton pump inhibitors is not worth it.
Yeah, I'd never heard of proton pump inhibitors before until we looked at number 7 there, omeprazole, and again, I went away and had a look at the problems, and sometimes the risk seems to outweigh the benefits. I mean, uneven heartbeat or arrhythmia, seizures, tremors, poor coordination, decreased vision, blistering, skin peeling, confusion, and a lot more. I mean, it's like playing Russian roulette with your life.
It really is. And granted, a lot of these adverse side effects are rare or relatively uncommon. Some of them are more common. Some of them are very common, but they all stem from basic pathologic mechanisms that we have a pretty good understanding of. And so you start depriving your body of some of the key nutrients that it needs for functioning, and that list could be endless. And that's really, that's what the proton pump inhibitor class is doing, is it's robbing you of your ability to protect yourself from everything that comes into your mouth, into your digestive system. And it's robbing you of the nutrients that you couldn't break down because you couldn't digest as efficiently as you should be.
Yeah. So we're going to be able now to jump to number 4, which is levothyroxine, which is a synthetic thyroid hormone. The fact that it says it's synthetic concerns me, but I imagine a lot of medications are.
Yeah, most of them. Yeah, most of them are. The manifestation of thyroid disease being so common in the population, and the problems that we have with so number 1, Synthroid, levothyroxine, is an inactive form. It's an inactive form of thyroid. So it's T4, and it has to be converted into the active form of thyroid called T3. That requires, coenzyme Q10. It requires a number of cofactors. And very often the problem that I have with these thyroid medications is, did we first make sure that you've got the key raw materials that thyroid needs to make thyroid hormone? Because one of them is iodine, and it's really deficient in the standard diet. If you don't live on the coast, if you're not eating lots of seaweed salads and seafood, and live in a more iodine rich environment, if you're relying only on iodized salt to get your iodine, you probably have an iodine deficiency, and your thyroid could be under functioning simply on that key mineral that needs to be replaced. Now, it should be replaced with some of the cofactors that are necessary for iodine to provide the raw materials for the creation of those thyroid hormones. That would be selenium. 4 Brazil nuts a day will get you the right amount of selenium. Now, iodine is tougher to replace, by the way. You can overdose on it pretty easily if you get some of those liquid iodines. So the product I recommend, and I take personally, it's on my desk right now. I just a little while ago took 2 of the Thyroid Plus, because it has iodine at the right dose. It has selenium at the right dose. It has those B complex, the B vitamins that are also necessary in the pathway to create your thyroid hormones. And it has the amino acid tyrosine, which is very necessary to create your thyroid hormones. Yeah. And so when you put those things together, I don't have to eat my seaweed salad with some Brazil nuts and, and a steak all at the same time every day because I can take it as a supplement. I choose to take it as a supplement because I don't like the texture of seaweed salads. But you can get it from your food, ladies and gentlemen, if you really know what you're doing, and you can figure it out if you look these things up. But we often just simply don't need the levothyroxine that they're going to probably dose improperly because they're going to give it to you once a day when it should probably be taken twice a day. They're not going to give it to you with a coenzyme Q10, or it could be that, I don't want to jump ahead of us, but I know what number one is. And number one is something that depletes the coenzyme Q10 that is necessary for that conversion of T4 to T3. My point is, often you don't need this medication. You don't need the expense. You don't need the imbalance that it can create. You can create a hyperthyroidism. You can suppress your body's natural ability to regulate that thyroid system. I mean, it's just more complex than that. And it's a quick and easy fix for doctors to just prescribe that pill instead of telling you all of the things like how that iodine, selenium, and those tyrosine isn't useful for many other processes in the body. So you're not wasting anything if you take that supplement. The other thing that I would say is your thyroid may not be working well because you got too much fluoride in your water, and fluoride interferes with that thyroid hormone production. By the way, it also interferes with your pineal gland and its production of melatonin. So get the thyroid out of your city, water, start filtering that. You have to use special thyroid filters. If you've got a Berkey system or a reverse osmosis, you have a special filter to get that waste product of the mining industry out of your water. That is big study in pediatrics a couple of years ago is decreasing the intelligence of children born to mothers drinking fluoridated water.
Yeah, and that's it. And the fluoride, as you said, is a byproduct of the smelting of aluminum or aluminium.
You got it. All right, somebody's done their research here. You're good, Chris. Yeah.
And the thing is, again, as a byproduct of aluminium, this again is majorly linked to Alzheimer's and people having cognitive function problems. So the fluoride in the water, it was supposedly put in the water during the war to dumb people down. And now they're just telling you, well, it's good for your teeth.
Yes. Oh my gosh.
I know they don't care that much.
I know. Yes, exactly, Chris. They don't care that much, and it's more than just the taking a waste product that would have been, and turning it into a revenue stream. It's more than that. It's a pointless, purposeless, dangerous intervention that I think is nefariously being used. And it is so interesting that it's associated with it's a waste product of the aluminum smelting industry, and aluminum is one of the other huge metal toxins that's being injected into our children with many of the vaccines. It's being nanoparticleized and being dropped from the sky and some of these chemtrails. I hate to tell you, it's real. It's a real problem.
Now. Yeah, it's proven. They're not even denying it.
And as you alluded to, it is probably the cause of Alzheimer's. And according to the world-renowned expert Christopher Exley of the UK, Dr. Christopher Exley says, without aluminum, you don't have Alzheimer's.
Yeah, that's it. So we're going to jump to number 3, which is albuterol, which prevents bronchospasm by relaxing the muscles in the lungs. What's the major concerns with this product?
Well, again, it's a beta agonist, meaning it stimulates the beta receptor system, and that's everywhere in the body. In fact, one of the any parent that has a child that's had to do albuterol inhalers will recognize that hyperstimulation of their sympathetic nervous system, that fight or flight. They're being put into they're super stimulated, agitated because of the stimulating aspect of that medication. We're again, it's treating a symptom of a disease process. Again, I would probably tie this directly to childhood vaccinations, because we see such a increased incidence of asthma in vaccinated children versus unvaccinated.
Yeah.
But there are better and safer ways that don't rely on hyper-stimulating a receptor system in your child that's going to basically put them into a fight or flight, fear, anxiety type state for several hours after use. I mean, if it opens their airways, it can be life-saving, but why are their airways closing? We need to treat root causes, not just symptomatic treatment and a lifelong dependence on carrying an inhaler around in their body. Their body is hyper responding to something in their environment, something that has damaged their immune system, their inflammatory control systems. We got to start treating the root causes, and we don't have to be, medicating our children and ourselves lifelong.
So effectively, when children and people have asthma, there's something attacking the body, and the solution to stopping this is to take something that attacks the body.
Yes.
It's crazy. Yes. That's insane. I mean, again, one of the major concerns when I looked into this, they say that it can cause the blood in urine, fever, nausea, back pains, chest pains. But the one thing that really stood up is the risk of hospitalization for those with asthma, causing heart rate, and the one that we mentioned before on other products, the blood pressure problems. So, sometimes these things, the problems they can cause, again, are outweighing the actual good that it's supposed to be doing.
Yeah, it's always a risk to benefit analysis. Yeah, so albuterol, it's like taking for a lot of kids, it will be like drinking a pot of coffee. It tremors, headache, nervousness, restlessness, insomnia, muscle cramps, dry mouth, dry throat, allergic reactions, nausea and vomiting. Those are the common side effects of albuterol. And many of them those are common. I've seen in my nephew, I would be in the hospital working, and he'd be hospitalized because of his asthma reactions. And they would put kids in these metal cages. I kid you not. I would go in, it looked like my nephew was in a metal cage in the hospital, because he was so agitated and, just overstimulated by the constant albuterol inhalations that they were administering to him. It's just tragic. But
the thing is with that, I mean, most parents, if your child was at risk and they were on the inhalers, they're going to send the child to school with that inhaler in the pocket, and they've got no oversight of when they're using it. I mean, the child might get a little bit out of breath and think, they might have been doing sports and taking it at the wrong time for the wrong reasons. And that with something that could be that damage causing, I mean, that must be a major failing in that product itself, just the fact that it can't be monitored in the hands of children.
And that's a really good point. You make a great point there. In fact, it does have some athletes, some individuals, they kind of abuse albuterol because of its stimulatory effects. So they're trying to harness that adverse effect. It causes this stimulation. Once you get kind of used to that, you can't abuse it. And they don't know that, especially young children, they don't have as good a control over that and understanding of the risks of that as they should.
So number 2 was lisinopril, which we discussed earlier. So we're going to go to the number 1, the biggest prescribed drug, which is something called atorvastatin, which
Lipitor, atorvastatin or statin. It's in the statin class.
It's a statin, yes.
Medication is cholesterol lowering medications, and this is this has been a huge controversy in medicine for a very long period of time. There appears to have been some collusion with the laboratory, insurance, and pharmaceutical industry to lower the standards. Keep lowering the level of cholesterol at which would meet criteria to sell more Lipitor. Lipitor is and the statin class in general has been number one most selling pharmaceutical drug for probably a decade now.
Yeah.
That many doctors think that it's so beneficial it should be put in the water. With
the
yeah.
fluoride.
They talk about it all the time. These statins inhibit the production of cholesterol in your liver, with the idea that it's cholesterol plaques in the cardiovascular system in your blood vessels that are causing heart attacks and strokes. So I like to, here's the way I like to characterize that argument. Claiming that cholesterol is the cause of heart attacks and strokes is like claiming that the ambulances are a cause of motor vehicle accidents. That, ambulances don't cause the motor vehicle accident. They are there to clean up the mess. Cholesterol is intentionally made in your body to plug those holes in the blood vessel wall when that single layer of cells, your endothelial cell, has been damaged, usually because of sugar, like sand being shot at high velocity down a pipe. The high levels of sugar, that's what's damaging our blood vessels. The cholesterol is a response to that.
Yeah.
Dietary cholesterol is not what's plugging that. It's the cholesterol that you're producing in your liver. Now, cholesterol is a necessary and a critical component in your body. It's a part of all your cells. It's the substrate for the creation of all your hormones, or your vitamin D. So vitamin D is a hormone that's based on cholesterol. If you drive your cholesterol down to the levels that many of these levels and doctors are treating patients to, you're going to be depriving your body some of the necessary substrates for healing and creating the hormones. Now you got a hormone deficiency. You want to create a testosterone or estradiol or a vitamin D deficiency and set yourself up for all of the things that adversely begin to affect you when those are diminished. That's what statins can potentially do. Now, but it's all about money and marketing.
Yeah.
The other thing that's really been the problem with how they promoted statins has been how they misuse the statistical the information coming out of the clinical trials. And I looked this up specifically so I could share it with you, Chris.
Yeah.
The statins increase the incidence of diabetes, type 2 diabetes, by about 9%. Okay?
But they've got a drug for that.
Yeah, exactly. And that's kind of the point. When they did the studies, let me put it to you this: there's three things that you should always look for and should always be required to be reported when they're trying to tell you that a vaccine is 95% effective, or Lipitor, lowers your risk of heart attack and stroke by 24%. They are using one of three statistics that really give you the full picture of how truly effective that is.
Yeah.
So they will tell you that they'll give you the relative risk ratio in treated patients versus untreated patients, or patients treated with standard of care. They'll say it will lower heart attacks and strokes by 24%. The absolute risk reduction in the population that was studied was only 1.2%. So absolute risk is 1.2%, meaning most people in that study had no benefit and no adverse effects. But here's the number I liked. How many patients do you have to treat with a statin to prevent one heart attack or stroke? And the number for statins, based on meta-analysis, multiple studies, you got to treat 83 people. So you got 83 people to prevent one heart attack or stroke. And that's industry-sponsored data, by the way. So and you got a 9% increase in type 2 diabetes, and the duration of the studies was short enough that you don't start to see the long-term effects of, depleting, decreasing, creating a hormone deficiency, decreasing your vitamin D, increasing your type 2 diabetes risk, etc. So you see the beneficial effects, but you don't see the long-term effects that result. And when you look at it in terms of relative risk, absolute risk, and number needed to treat, you start to see a picture that I think we should be giving patients who are smart enough to understand that, does it prevent primary heart attacks and strokes? No, it doesn't. You shouldn't put it in the water until you have studies that show that it will prevent the first heart attack or stroke from occurring.
Yeah.
The only studies that have shown any benefit for statins are after cardiopathic patients that have already had a heart attack and stroke. That's the only evidence for the use of a statin. And the best speaker and expert on this issue is actually Dr. Asim Malhotra, cardiologist out of the UK, who also came out and said, the COVID vaccines need to be pulled from the market. And so he's been speaking on that issue, and it's just how we're being manipulated with, the use of statistics to make you believe that, your chance of having a heart attack and stroke is going to go down by 24%. That's not what the studies are telling you. It's more like 1.2%.
And the funny thing is, and I don't know whether I'm making a connection that's right or wrong here, you mentioned about the fluoride going in the water, and we know that can dumb people down, and that's when it's been used in wartime by the enemy. But if they were thinking of putting statins in the water, and statins drop the cholesterol within the body and reduce it right down, would it also be breaking down the very much needed cholesterol, which forms the brain matter?
Yes. Yeah. Because that's another important purpose of cholesterol, is maintaining the fluidity of your membranes of cells, all cells. Yeah. Very important. And it's a huge, I can't remember the exact percentage, but it's a huge percentage of the various molecules that are found in the brain. And then the other side of it, Chris, is are there nutritional alternatives? And absolutely there are. In fact, the statin class of medications was derived from red yeast rice. Several studies have suggested that red yeast rice supplementation lowers your cholesterol levels as much as a statin does. And then there's, soluble fibers, garlic, lots of studies. So the 5 or 6 things that I would list that have evidence-based medicine that would suggest that can improve your lipids are garlic, omega-3 fatty acids. It would be red yeast rice, soluble fibers, plant sterols. So I said omega-3s, I think, from fish oil. So all of those things can be taken, and they don't cause type 2 diabetes at an increased rate of 9%, right? But you're not going to hear about those from your doctor, because your doctor didn't get enough training in medical school. He didn't do a nutrition fellowship like I did. They don't have all the tools in their bag that they should be bringing to your care. So become a scientist of your own health, and you can do a lot of those things. And here's the other thing I would say about lipids. The problem, as I said, it's not the ambulance. It's not cholesterol. It's sugar. It's triglycerides. Look at your triglycerides to HDL level. You can raise your HDL with niacin. You can do it with exercise. There's lots of ways to improve your HDL, your good marker of adequate the high density lipoprotein. And you don't need these drugs with all these side effects to achieve a lot of what you need to achieve. You can just you can limit sugar in your diet, Chris, and those triglyceride levels, which the triglycerides to HDL ratio is the marker for cardiovascular risk. It's not cholesterol. It's not cholesterol and LDL. That's been contrived by a pharmaceutical industry that wants to sell you that wants to sell you drugs when your doctor should be talking about, come on, man, we got to stop eating the Krispy Kremes, Mountain Dew, and McDonald's. Let's do an intermittent fasting diet. Let's get smart about the ratios of healthy fats, the avocados, the coconut oils.
Yeah.
Let's get some omega-3s and soluble fibers into your diet. It's not difficult to do that, and you can still have a delicious diet that you won't become addicted to because you want that dopamine surge from the high fructose corn syrup and the high sugar content. 22 teaspoons of sugar in a 12-ounce bottle of Mountain Dew. Come on. Why did they put all that there? So you'd become a consumer of their product as they biohack your brain chemistry and get you addicted to their product.
Yeah, it's ridiculous. Now, with this being the number one selling prescribed drug on the market, and again, I'm going to go back to the water tables. Would this already be in the water table just for the fact that there's that many people on statins that when it gets put back through the water system, it's already in what a lot of people are drinking unknowingly?
I've seen some evidence of that. So I was kind of laughing or giggling as you were, as I see them talking about, oh, it should be put in the water. Yeah. Well, it's already there. Are you just kind of, predictive programming us for starting to see this? Yeah. A lot of the drugs are appearing in our water supplies, and all the more reason that you got to be really careful and filter your water. I mean, opioids, you look at we talked to opioids was number 10 on this list, right? Well, if you're eating mussels off the coast of, I think it's California and Boston as well. So mussels, these filter feeding organisms, mollusks are filtering everything that's in the water, huge levels of opioids. Now we'll have some people, there might not your listeners, but there are people probably diving for, to get their fix from some oysters off the coast of California and Oregon, Washington, that are trying to, get that high. So these filter feeders are accumulating these toxins in their bodies, and it's everywhere, even in the ocean waters off our coasts.
Maybe that's how it explains the supposed aphrodisiac effect of oysters. Maybe people are just getting high on them and not even knowing.
Yeah, I've always believed I was told it was zinc or some other thing, but there's a whole new level of aphrodisiac effect nowadays coming from, the toxicity in our environment.
Yeah. Now we're down to number one. I think both of us were very surprised that we didn't see the SSRI antidepressants, which are massively prescribed to many people around the world. But let's touch on that. Let's touch on, we know that they are massively, and a lot of people watching this may be on, the Prozacs or any other antidepressant drugs. But these have some serious consequences, don't they?
Oh, absolutely. They do. I mean, how about suicidal ideation? How about flattening your effect, diminishing who you are, suppressing, these are one of those class of medications that, well, let's start also by this. Every study that has really looked at this has shown that placebo outperforms SSRI antidepressants after 6 to 9 weeks. Yeah. And the reason for that, Chris, is that when you are trying to alter a neurotransmitter level in the body, this is where these homeostatic ranges come into play. You can temporarily elevate your serotonin levels, which, by the way, the 4 or 5 months ago meta-analysis looking at the serotonin deficiency as a cause of depression has been, completely again debunked. It was a made up theory that they looked deeply for to find, including looking in the cerebrospinal fluid, the CSF of the body and the brain, looking for evidence of, do these people have lower serotonin levels floating in their bloodstream and their central nervous system? And nobody's been able to demonstrate any evidence for a serotonin deficiency being a cause of depression. it's multifactorial, but they created this false narrative around serotonin deficiency because they had a class of, it's another pharmaceutical construct to create, because they had a class of drugs that would work on that system. It was worth looking into and seeing if it would be therapeutic. And it can artificially elevate your serotonin levels for a number of days or weeks in an acute crisis, severe depression, just, a collapse, morbid depression that comes maybe after a loss of a loved one, a difficult divorce, whatever it might be. There might be a short period of time where it can be life-saving to take somebody out of the suicidality that they might be experiencing, but it's not a long-term, there's no long-term benefit in it. In fact, the more you use the medication and the more your body tries to push your levels back into a range and a signal strength that it's used to seeing, then you'll become fragile. Your receptor system will become fragile, become dependent on the drug. And if you miss a dose, if you forget to get your refill, you can crash into a withdrawal state that will leave you psychotic, depressed, more likely to be suicidal or homicidal. Yeah. And we've seen too many overdoses during the pandemic that had those elements. Almost every mass shooter in the history of America has a psychotropic drug background in the reason for why they did what they did, or an underlying reason for that. It's again, you have a very complex system in the neurotransmitter system. You're not going to be able to crutch that with a drug for longer than 6 to 9 weeks. It's like if you injure your knee and you have to lean on a crutch, well, it can be beneficial for a short period of time, but if you lean on it too long, now you got shoulder problems and you got other problems, atrophy. We got to teach people how to, pick themselves back up and cope naturally instead of, a unnatural chemical compensation mechanisms, because they won't last and they'll end up causing all kinds of other problems. You want to increase your serotonin levels, sleep under a weighted blanket, make sure you're getting the dietary intake that you need. Walk in nature. I mean, there are things, there's so many things, and the best approach to dealing with depression and anxiety is exercise. Again, outperforms antidepressant therapy every time. Anxiety or anxiolytic therapy every single time. Get up, get moving, get back up on your feet again. Counseling, talk to friends, hug and embrace your community and your loved ones. But if you think a drug is gonna make you better, it won't. I wish it did. But I have seen the fallout, the trauma, the destroyed relationships. There's whole, Facebook and social media groups dedicated to how SSRIs have destroyed relationships, how have turned people into flat versions of themselves, unemotional versions of themselves that don't want to engage. That breaks my heart. Be passionate, have emotions, feel anger, irritation, love, pain. It's all a part of the human condition. Don't be ashamed of those things. They are cathartic and they are healing. And don't medicate them away.
Yeah. And it got me thinking, with the SSRIs, and it's probably going to lead me to the final thing I was going to mention. We talked about events there that will trigger these psychological effects in people. And I have to consider that what has happened over the past few years may see a massive uptick. Maybe these SSRI antidepressants may make the top 10 over the next couple of years because of the damage we have seen from what has happened over the past few years with COVID. And of course, that leads me as well, thinking about that, we've gone through the top 10 selling by numbers. But again, making that list has to look at the most profitable for the pharmaceutical industry, as well as what I think will become probably the highest number of uptakes, which has been these vaccines for COVID over the past few years. Can you see both of those events happening there?
Oh, absolutely. Yeah. Not only because you can see the narrative that they're trying to build to create the coercion and the mandatory nature of these things, Chris. So, the pharmaceutical industry has figured this out. They know that with a lot of the prescription drugs that we've talked about, they could be held liable for injuries, and they have for many of these drugs and drugs in this class. They've been taken to court. Discovery has been done, and we found incredible corruption in the industry. But with vaccines, they're protected from liability in court cases, and they're protected from everything except willful negligence and fraud, essentially. And we're going to get them for that, because there's been willful fraud that's been perpetrated, fraud in the studies, not sending to the FDA the full data and the data that they should be providing. But the business model for vaccines is huge, and many of my colleagues that are kind of in the same place I am in terms of the childhood vaccine, the CDC recommended childhood vaccine schedule, which has such a horrible, non-existent evidentiary basis beyond observational studies, no gold standard randomized controlled studies, but got liability immunity back in 1986 with the National Childhood Vaccine Injury Act. Yeah. They had a captive demographic. Every child in America is getting up to 78 vaccines now between the first day of life and age 18. Yeah. But everybody has been saying they've got the children, and we're seeing the fallout of that, but they're coming for the adults because that's the real market. And so that's what we're going to see is they're coming for the adults, and they'll try to mandate them just as they are doing in New York and California. California's rate of autism and neurodevelopmental disorders in the children, because they required them for every child going to California schools. They've seen an explosion of autism in that population. They're seeing the same thing in New York and New Jersey, but they have created a framework for mandatory vaccination. Yeah. And it's a huge business model. There's more money in it because, well, mRNAs are a cheap platform. That's why they're working so hard to cover up the mistake that they've made, and they will continue to make with mRNA. They'll cover it up. They've created a brilliant false narrative. They have liability immunity. Their profit margins are extraordinary, and they didn't do the research. They didn't do the original research. The taxpayers paid for that. They licensed it. They're making hand over fist. Pfizer's buying company after company now because they have so much money. They don't know what to do with it, and that is not going away. There's several hundred vaccines in the pipeline. The vaccines for our animals, well, they've been mRNA vaccinating the pigs. The pig industry has been using mRNA vaccines for 2 years now. Yeah. And there's bills all over the U.S. That are introducing legislation that would prevent the public from knowing what type of vaccine it was. In Missouri, Attorney Tom Renz is fighting a bill in Missouri that they're trying to not report to the public or label any food, any beef or chicken that is being vaccinated with mRNA vaccines. Soon we will be eating not just Bill Gates's, lab-grown chicken, but we will be eating, trans hybridized, mRNA gene therapized meat of all kinds. And if we don't stop it, we are going to be eating genetically modified stuff that will genetically modify us.
Yeah, it's crazy. And, you know, as you said about the massive profits there, you know, everybody watching this today, please don't forget your doctor is financially incentivized through the
Hugely.
pharmaceutical industry. So there's that. So I think that's a great time to wrap up what I now call the top 10 prescribed killers that you may be on. And if it's not you, it may be your family, it may be your friends. So share this if you care about your family and friends. If you do want to seek further health advice, Dr. Jim Meehan is available. The links are in the show notes here. You'll be able to go straight to his website, get the best advice, get the best health products, ones that are not going to give side effects and problems to your body, and take back the power, become responsible for yourself, and be the best that you can be in health. And question everything your doctor tells you, because as we said, it can be financially incentivized by the very pharmaceutical industry that seeks to profit from you not being well at all. Thanks very much again, Jim. This has been an incredible talk, as always. And we look forward again to breaching upon another subject in next month's health segment with us here at the Atlantic.
I'll see you and your listeners and viewers next time, Chris. I look forward to it. God bless you all.
Thank you very much.